What's up, everybody? I hope you guys are doing well. So I'm coming on today to answer a question that I had promised that I would answer in a separate video. And this is the question where people are asking why I chose to go into family medicine as opposed to other specialties. So the thing is, personally, I think when it comes to choosing a specialty, you have to pick a specialty that suits your personality. Like, I cannot emphasize that enough. Because a lot of people will go on to pick specialties based off of what their friends are doing, what their parents did, or what you see in the media, whatever specialty you think it's got the hype, or the one that you think, oh, I'm gonna make the craziest money or whatnot. But the most important thing, I think, out of all of this is what really works for you. So in my case, a lot of people who know me know that I'm passionate about emergency medicine. I love working in the ER. I have extensive years of experience working in the ED, even as a nurse practitioner, being a director in there and all that stuff. But when it came time to decide what specialty or what residency to go into, I actually chose family medicine. I was almost at that point where it was a little hard to decide, should I apply to family medicine or should I apply to internal medicine or emergency medicine? There's this thing about a lot of IMGs that's the advice we get too, like, just try to apply to IM or FM because that's most likely where you have the greatest chance at matching, which is true, of course, but at the same time, it doesn't mean that we're not able to match into other specialties. I still believe that I would have had a great shot at getting into emergency medicine residency if I had applied to it, but I wasn't interested in that. And my main reason for not doing that is, in as much as I love working in the ED and everything, I think of like the burnout and all of that stuff like much later. So for family medicine, especially unopposed family medicine, which is something I got to learn about during like application season and stuff like that, like researching where to apply and like what kind of family residency programs are out there, the kind of training you get. That's when I got to learn about unopposed family medicine, and that really did resonate with me for sure. Because with unopposed family medicine, it's more like they're training you to do it all. Yes, you're a family medicine physician, you can see kids, you can see adults, pregnant women, you can work in inpatient, outpatient, you can work in the ED. It's that versatility, that diversity in clinical settings where you can work. That's something that really, really, really excited me when I got to learn about unopposed family medicine. Like in my program, most of the graduates, they actually go on to be like hospitalists. I know a few that have gone into emergency medicine fellowships, and some have gone to work in the ED and stuff like that. Inpatient, outpatient, you can work, group practice, your own personal practice or whatnot. So there's so much that I can do with it. That was the reason I chose that. And also, I like the fact that even with family medicine, I still get to do what I really love, which is emergency medicine. So I'm still able to see patients. Like my ideal practice, to be honest, is outpatient, in addition to being able to see my patients in the hospital and also like admit my own patients and also work in the ED as well, like the rural hospitals, community hospitals, things like that. So I see it as combining the best of both worlds to actually achieve what I really want. So to answer that question, the reason I chose family medicine as opposed to any of the specialties, because that's the one that suits my personality at this point. The other big factor that I cannot forget to emphasize is the fact that it affords you that work-life balance. Now, if you're a parent, if you're someone like you've got a family or all that stuff, or say you don't even have a family just yet, you're looking to have a family in the future, having a stable work-life balance is something that's crucial, definitely crucial, because what sense does it make to work in medicine or to work in any other kind of career and not be able to have that sort of stability and have some sort of balance to it, So I really think with family medicine, I can definitely get that out of it. So that's my main reason for going into family medicine. I have the opportunity to do what I want to do, spread my wings, enjoy it, Oh, and the other thing too is with family medicine, you also have like fellowships that you can go into. Like for me, I I am considering emergency medicine fellowship, so it's more like additional year or two to extend your training in the ED setting. So I'll still be able to do my family medicine, but also be able to practice, work in the ED as well. So like I said, I'll be combining the two specialties that I love so much, family medicine and emergency medicine. So the work-life balance, the diversity, the versatility of different places where I can work made me choose family medicine. And I do hope everyone out there, when it's time for you to choose a specialty, make sure it works for you. A lot of specialties out there, you're having like to be on call several hours, stuff like that, middle of the night, things like that. But at this point in my life, no, I'm not looking for that. Definitely not looking for that. And that's the reason I